Hello, everybody. I'm Dr. Michael Reiner, and welcome to the Independent Doctors of Pahrump. Tonight, we're going to have a little abbreviated show. Dr. Savran was back in Las Vegas tending to his duties there. And so I'll be running the show tonight by myself. Now, we have stated in the past that we would like to highlight some of the independent practices and some of the independent practitioners in town. And hopefully, in a few minutes, I'll have Arthur with Pahrump Medical Supply as one of my guests tonight. He runs a medical supply shop kind of close to my office on the corner of Pahrump Valley Boulevard and Calvada, and you've probably seen it as you've drive by one of those particular areas. And I wanted to talk a little bit tonight about durable medical equipment, and that's the term called DME, and you may have heard that, and that's something that we often order as physicians for patients. That could be a hospital bed, it could be oxygen, it could be concentrators, oxygen concentrators, small devices, nebulizers, catheters, a whole host of supplies that patients need for home health or home care. And wanted to discuss some of the issues associated with durable medical equipment. It's one of those areas that we as physicians send orders, and we don't really always understand the complexity of getting those orders filled, co-pays, how much things cost, and in today's world, everything's driven by, unfortunately, the insurance companies who only want to pay so much for the items that you need to help you have a healthier life. And one of the things that I prescribe a lot of, and one of the things that seems to be big in my practice, is the use of oxygen. It came to my awareness that my brother, who is an ear, nose, and throat doctor, we were discussing patients and sleep apnea, and he was discussing how that people who are taking pain medications and certain other sedatives are at risk of sleep apnea if they have it, making it worse, and hypoventilation, which is a term meaning that they don't actually stop breathing, but they don't breathe as deep. And this is actually a very severe problem, because as you take medication for pain, or you take medication to relieve anxiety, or you take medication for sleep, your level of consciousness falls below that state, which we all kind of exist in. And then the deeper into that level you go, you tend to breathe more shallow and not as deep. As a result, your oxygen saturations, or the amount of oxygen in your blood, tends to decrease. With that comes a whole host of cardiovascular changes that take place, none the least of which is that the circulation between the heart and the lung is a very short circulation, and it's usually a very low pressure system. That means it doesn't have to move that blood through your body, so it moves it on a very short distance. And as oxygen levels fall below a critical level, and that critical level is established by science and as well by Medicare to be 88% and saturation. And what that means is when the amount of oxygen in your blood falls below 88%, what that does is it actually causes a constriction or a narrowing of the arteries that go to the lung. And if that is to set up on a more permanent basis, meaning it happens over and over and over again, then you're dealing with a condition called pulmonary hypertension. And pulmonary hypertension is an irreversible condition of the lungs. And it makes it harder for you to breathe. It makes you more short of breath. Not only that's one side effect, but the most serious side effect amongst all of those things is the risk for heart attack. I mean, as your saturation falls, your heart has to work work harder. The other factor is here you are taking something to help you sleep, or you're taking something to help with pain, and in fact, when your body has this natural alarm in your system, so as your saturations fall below a certain amount, your body wakes you up, so you never ever really get into what they call deep sleep or REM sleep, called rapid eye movement. And that, when you're not getting that restful sleep and REM, which is not the group REM, but rapid eye movement sleep, you're fatigued the next day. So this is the most common complaint I hear patients say, "Oh, well, I sleep very well, Dr. Reiner." And I said, yes, but nobody's really watching you sleep, and nobody's really testing your oxygen levels when you sleep. So one of the most common causes of fatigue that I've seen is people not saturating well at night. And when they're placed on oxygen, and when they actually have the ability to breathe, or keep their saturation up. This is not a mask per se. It's not a CPAP which forces air into your system. I find that more commonly hypoventilation, or not getting enough air into your lungs, or the oxygen into your lungs, is more common than actual true sleep apnea. And correcting that situation helps patients achieve a better level of functioning in the day. It helps their overall demeanor. It helps to control depression from chronic pain. So it's a very, very intertwined and intermingled set of issues that usually starts with people taking something for pain or taking something for anxiety. And it could be as much as having a couple of beers before bed. It could be having a couple of shots before bed. Same thing. You basically lower your level of awareness and your body, and you decrease your breathing, and therefore your saturations fall down, and you're never really rested for the next day. So this is actually a bigger problem than people care to admit. And with males, if you're not sleeping deep, there's a low testosterone issue that comes from that. So now you start getting into weight gain because you're tired all the time. Then you get into low testosterone levels, which makes you tired. So it's a very vicious cycle of saturation issues and oxygen saturation. This is something as simple as wearing a pulse ox on your finger while you sleep, and we test your oxygen while you sleep. And if we see those dangerous levels developing, we can repeat that test on oxygen and see that you indeed improve with oxygen. And we find that most people do, and they seem to improve dramatically. Now, we do have a live show tonight, and that number should be on your screen. If not, they'll put it up there at 727-8750. And when we go to break, I will have my guest, Arthur of Pahrump Medical Supply, on here, and we'll start this discussion about durable medical equipment. I want to highlight his business. I want to highlight that he's been in this community, and I don't know the number of years. I'll find that out. I know he does ultrasounds at my office. He's worked previously with me at Dr. Tenari's office, we do want to support the independent practitioners of this community, whether it be doctors or nurse practitioners, medical equipment suppliers. We want that. We don't want to be lulled into a big group mentality where, this is the way it is, and if you don't like it, it's my way or the highway. And personal service is what's important, getting to know the people that are going to be supplying that equipment to you, and there's no substitute for one-on-one companies and people. The other thing we wanted to talk about is like I say, he's close in the office. They deliver, and we'll get into all of that after we come for the break. Now, you can call in with your questions, and when those questions come in, I won't have a moderator, so we will take your question, and then they'll be forwarded to me, and we will try to answer that as best as possible. So again, I want to highlight Arthur. I want to highlight his business, and hoping down the future we will have a few other independent people coming on this show. And I want to talk about the major necessity of oxygen. And again, remember, low oxygen saturations are definitely the key to how you sleep and the fatigue associated with the next day. And there is an overabundance of patients that are using pain medications in this community. We live in a society where arthritis is, our population is aging, and a lot of people are using pain medications to help them sleep and to help them get through the next day. And again, this fits in with Dr. Saverin because he sees a lot of heart disease, and we'll probably bring this up again when he comes on the show next time. So anyway, we're going to go to break, and when we come back, we're going to have Arthur on the show, and we will start the discussion. And again, thank you very much for tuning in tonight.